to show specifically the kind of work that you're doing and how it aligns with what they want you to do.
Careful, Gaspar. I don't want
grants. I mentioned a couple of these. We've got private foundations, and those do include local community foundations, United Ways, you have family foundations, different kinds of other private foundations, and then corporate foundations. Obviously, they're connected with different kinds of businesses. Then you've got government grants at all different levels, local, state, and federal. And then different funders are going to have a different process. So sometimes they ask you to submit what's called a letter of intent, LOI, which is really just a first, more informal stage in the application process, where you talk in more general terms about the work that you're proposing to do. And then if you get past that round, then they would ask you to submit a more complete proposal. And a more complete proposal will be much more involved, typically, and lay out more specifics about what it is you want to do. Another way that sometimes grant-making organizations ask you to do this is they'll call it a pre-app or a pre-application and then a full application. And then other organizations actually just have you go ahead and do a full application from the beginning. So obviously, whatever the organization is that you're seeking funding from, make sure you're really familiar with what their process is and follow their guidelines so that you know what you need to do when, for what kind of deadlines. So in terms of how specifically to write a successful grant, as I said before, these are tips that really go across any kind of funding source. And I know that in many cases they're going to sound really basic, and for those of you who have written grant applications already, you'll probably be nodding your heads and saying, yes, absolutely. But it's amazing, even people who have done a lot of grant writing, how easy it is to forget sometimes the basics or the simple guidelines. So that's why we wanted to start with this, which is really, please always try to use clear and simple language. You should always assume that whoever is reading your grant application knows absolutely nothing about you. Do not make any assumptions. Even if you feel like you're very well known in your community, please always be very clear and simple and try to explain to the fullest extent that the space will allow you who you are and what you do so that they have a clear understanding of what you're saying. So you want to make sure it's really easy to read, that you don't use a lot of acronyms, make sure you spell things out. And one of the guidelines I give folks that I work with here in the local community is really you should be able to give your proposal to a friend or a family member, someone who doesn't know maybe a lot about what you do, and they should be able to read it and picture what it is you're describing. Try to use the active voice when you're writing. It's an easier thing for people to read, and it sounds more proactive, and I think that's a good way for you to sound in the application. Make sure you actually answer the questions that are asked. I cannot tell you the number of times as a reviewer I have read applications that do not actually answer the question that is posed to them. So, you may have some kind of standard boilerplate language that you use to describe your work, but make sure that you actually really answer the question that's asked. And then try as much as possible to mirror back the language of the granting organization. So if they talk about wanting to make sure that children are healthy and you're applying to them around diaper need, make sure you talk about the need for diapers in terms of promoting children's health. If what they're talking about is making sure parents can go to work, then talk about it from the standpoint of how diapers enable parents to go to work. So really use their own language to show that alignment. So when should you apply for a grant? Well, you definitely need to have a plan first. You want to make sure that you have clearly identified what you're about, the kind of project or program that you're working on, and then seek funding out that would help further that. You definitely don't want to be seeking out funding that doesn't fit for who you are and what you are and then try to make it match. I've seen that before. It's mission creep, so people kind of grab onto dollars because they are in need of dollars. Everybody's in need of funding, but they end up getting away from who they really are, and it shows. And I have to say, in many of the grant application review processes I've been in, we do not fund things that do not look like a good fit or a real part of an organization. Make sure you provide everything that the funder is asking for. They will consider how complete your application is, and many times it won't even get past the original screeners or the initial screeners if you don't have all the documentation that's required. And if for some reason you do, when people start thinking about, well, how credible is this organization and how much do they kind of have their act together, that can creep into people's thinking about, well, they couldn't manage to get everything together for the grant application, so I don't know how well they'd actually do in implementing this program. So all of that reflects on your work. So you need to make sure that there are some questions that you can answer. You know, every grant application is likely to be a little bit different, but there are some similarities, and there's some key questions that you really need to make sure you can answer. And I think it would behoove everyone to think about those even before you have an actual grant opportunity, because oftentimes timelines are fairly short, and the more you can already have some of this planned out and thought out, the less of a mad dash it will be in the actual grant writing process. So you need to make sure you can answer questions about the budget. So how much money do you need to do whatever the project or program is? How much do you already actually have in hand, from what sources? And then if you, given that you have a gap and that's what you're writing this new grant application for, how would you actually use those dollars? I have seen too many failed applications include lots of things in their budget that they never actually refer to in their narrative, and they never describe why they need a staff person. That's a big part of their budget, or they never explain why they need you know, a particular item. And it's not that those items are necessarily disallowed by the funder. It's just if you don't explain why you need it and how it is connected to your actual program, they have no information on which to make a decision. You also need to be able to answer questions about how you're going to measure your outcomes. So what kind of difference will your work make for the people that you're serving, and how will you measure that? And then you, and I mentioned this earlier about the budget really, is what are you going to do with the money that you're asking for? So you need to be able to explain very clearly how that's linked. And I highlighted this a little bit earlier, but just want to underscore it, just to make sure as attractive as different pots of money are, and as much as all nonprofit organizations need more funding to do their good work, I think it's really important to make sure that you're really only putting your time and energy into applying for grants that match your mission, because you only have so many hours in the day, and it's not worth your time and energy applying for things that you know are obviously not a good match for you. And definitely don't go after the money if it's going to cause you to have to change who you are and what you are. And in any application, try to show as much as possible how what you do is a good fit with the grant application and the parameters that the granting organization has established. And then lots of times you'll notice that granting organizations really want applicants to partner with others. And in some cases, they might even give extra points or favor collaborative or partnership approaches. And so I would always encourage any nonprofit that's looking to, seeking funding to think about what other organizations in the community could be good partners and might be able to go in on a grant together and show how they can provide more services for children and families than either one of them could alone. I will say, having been a granting organization to collaborations and having been part of collaborations, they are hard work, so I don't want to pretend that they aren't. But they can be very rewarding. They need care and feeding, so you can't just write a grant application and then think that everything's going to be hunky-dory. I mean, you do have to work at the partnership, but there is tremendous payoff for that. And I will say, this seems probably pretty basic, but never write a grant application and say you're partners with someone and have not talked to that partner. I cannot tell you the number of times people have submitted a grant application and say, well, we're partnering with agency XYZ, and then we actually get a whole separate application from agency XYZ, and they're both saying they're going to do the same thing, and they actually never really talk to each other. Just one of them wrote the other one in. So then that really diminishes both organizations' chances for funding because it looks like they really don't communicate at all. So never write anybody in unless you've actually talked to them and think that you can make a partnership work. And then in terms of making sure that the grant-making organization recognizes how credible your organization is, always highlight the successes that you've had in the past that show, give actual proof that you're going to be able to do what you say you're wanting to do and that you want this money for. It's important to show you have a strong board of directors. I think you have, in some cases, grant-making organizations will allow you to have letters of support, which is a more formal way for other organizations or individuals to show their support for your work. And if they don't ask for letters of support or they don't allow letters of support, then you can write into the narrative different ways that you've gotten commendations or recognition in your community for the work that you do. And then explain why you're the right organization to do this project. And in some cases that means spelling out who else is in this field, who's doing what, and how you're filling a particular gap. And I think the more that you can provide specific examples that support your answers, that gets back to being really clear about the work that you do, who you are, and answering the questions, the better off you'll be. And like I said, just don't ever assume that people know anything about you. Always act as if they don't, and it'll probably feel to you like you're over-explaining, but I promise you, for the people who are reading lots of grant applications, it will help make your application stand out because then they'll say, oh, I see how this all fits together. I know who they are. So another thing that's important and often funders want you to be able to do in writing a grant application is they want to make sure that you have established what the actual need is. So I know in the grant applications that we put out, that our United Way puts out, we ask people to tell us, so what is the need in the community? Who are you going to be serving? Who else does this work? And why is your work necessary? So show how you've determined there's a need for diapers. Have you done a needs assessment? Have you talked to others about the need in the community? Have you talked to potential partners? Try to share as much data as you have about what's going on in your community. And I think that's actually another way to show your credibility as an organization who's in touch with your community, is if you can provide that data. The other thing is that it would be great to show that you've got a plan about how you're going to distribute diapers, and if you're going to consolidate or partner with others who either do diaper bank work or have kind of complementary services that you could partner around. So we talked earlier about how you need to know what kind of outcomes you're hoping for. And so you need to be clear about what it is that you want to change. What difference are you going to make for the population that you're serving? And then how are you going to measure that difference? And so there again, depending on what the specific focus is of the grant, you might pick particular measures around health, if that's what the funder is asking you to focus on, or what the application process focuses on. If it's around parents attending work or around decreasing abuse and neglect, you should pick your measures to align with the focus that the grant-making organization has outlined. What I would say is that just counting the number of diapers just in and of itself is not really an outcome that funders would get particularly excited about, because it doesn't allow a funder to understand what kind of difference those diapers made on the children and the families who received them. So I really would encourage you to think hard about that question of what difference is this making. I think in terms of a plan to measure the outcomes, you need to be realistic about the number of outcomes you're including. I, as a funder, would always rather not see a list of 5 to 10 outcomes. I'd rather see 2 to 3 and a realistic plan for how you're actually going to collect the data and then use the data to inform your programming.
Jennifer, one thing that we didn't put on here, but I thought it would be interesting if you could talk about for a minute, is a little bit about the different ways people talk about outcomes.
Sure. So some folks may be familiar with the logic model, and that is a framework for talking about what kind of outcomes are you hoping to achieve, and then kind of work backwards from those desired outcomes and talk about, okay, what are my activities that I'm going to do, and then what do I need? What are my outputs, which are just counts? What are the activities that will get me to those outputs, and then what are the inputs or the resources I need to do the activities? Had to think for a second. Haven't done the logic model in a while. So that's one framework that people use. Other funders, particularly here in Connecticut, and some other states as well, but I know Connecticut, it's been a big push, are really using what's called results-based accountability. And it's somewhat different from a logic model, but if you already have a logic model and someone asks you for something in RBA, results-based accountability, you can make the transition fairly easily. But in RBA language, people talk about results. And the way you measure results in RBA is you think about how much, so how many units of service have you provided, how well have you done it, and then who's better off, or what's the impact of that service. And that's a pretty easy way to think about the different kinds of results that you might be seeking. And then you think about, okay, so what are the strategies and the partners who would get me to those desired results? I would say those are probably the two most popular frameworks. But there again, that's where reading the requirements of the funding organization are so important because, you know, sadly for you guys, all the different funders are not on the same page in terms of the language that they use and the way they want things reported. And so you need to do it in the format and using the language that they ask.
So then when people ask about outcomes, you have to know how you're going to measure them also, right?
Correct. Absolutely. So I would be careful here not to overpromise in the sense of putting up these, you know, wildly fabulous outcomes that you have no chance at all of measuring, because that will demonstrate that you haven't really thought through the complexity of it. And I would say, from my experience with diaper banks, you know, one of the challenges is working through a partner model in distributing diapers. Collecting good data is going to require the participation of your partner distributing organizations. And that is not always easy, even among very well-intentioned people, because it takes time and energy that often people don't have, or technology that people don't have. And so you need to, I would try to build that into those partnerships from the beginning as much as possible.
Thank you, Jennifer. You're welcome.
Sorry, I was on mute. As Jennifer said, there are a lot of different variables often in identifying, you know, what a diaper can, the changes a diaper can make can also be dependent upon a bunch of different variables. So you want to isolate the variables as much as possible and plan in your grant for measuring. You'll need to think, what are the things you can accomplish? How can you measure those? Will you count the diapers you give out? Will you count the numbers of children and families you give out? Are you measuring attendance at agencies that receive the diapers? The metrics chosen must correspond to your desired outcome. Measuring diapers, number of diapers changed is unlikely to give any sort of meaningful information about attendance statistics, but you also want to verify that you've identified and isolate other variables that might have impact on attendance stats. You know, are you able to measure the numbers of days parents put their children in daycare in the first place? Are you able to measure other things that might cause attendance variables, you know, sickness, days out because of other functions, holidays or whatever else. But identify the variables, identify the outcome you want to measure, and work back from what variables could impact that outcome, and try to isolate, to the extent possible, the impacts your diapers will make when developing your measurement system.
One thing to add to that is that many diaper banks say that they use their diapers, the agencies use their diapers as incentives. If you are telling grantors that people are using your diapers as incentives, you need to be able to give information about that. So if the agencies you're giving diapers to say, we're going to use this to get more moms to come to our parenting programs, you need to be sure that those programs are keeping track of that information, because at the end of the grant, you have to report. And I guess that's one thing we probably should have put that in the part about why do you want to measure for outcomes. You want to measure for outcomes because it's the right thing to do, and certainly you don't want to spend money on something that doesn't work. But you also want to measure because any grant you get is going to have at the least an annual report. And many grants that might not even be for that much money can have even quarterly grant reports. And if you don't report accurately and adequately, it makes getting your grant next time harder. Now, that's not to say that if you say that you're going to measure something and you're trying to, and as time goes by, it becomes clear that that's not an accurate measurement of what you're doing, you talk to your grantor, and they will very likely say, you know, no worries, you know, we'll figure something different out, but you need to be in contact.
And actually, Joanne, could I add one point to that? Certainly from a grant-making perspective, even when people are able to collect the data that they said they were going to, and then they don't meet the outcomes that they had hoped for, that's really okay as long as there's some kind of explanation about why that's the case. Where it gets problematic is when there wasn't a good effort made to even collect the data, or there's no explanation or thought behind, okay, so why was this harder than we thought, or why didn't this work out the way we thought? So I would always say, you know, never fudge your numbers to look better. You know, be honest, even if they aren't what you wanted them to be, but then say why. And most grant-making organizations understand that life happens, and that they're happy to see people learning from their work.
But that does sort of suggest that when measuring success, you've got to identify things that can be measured. You can't say that the outcome you're proposing for your grant will be, you know, the skies will be blue, or that children will be healthier if you aren't actually having any way of measuring children's healthiness. So make sure that the hypothesis you put forward in your grant is supportable and is directly attributable to what you're proposing for the grant. And I would always plan for some portion of the budget to go towards setting up the measurement program and the measurement mechanisms in addition to the money being spent on diapers. So if you will need surveys, if you'll need any sort of going in and collecting data, just plan for that up front in your grant proposal.
I think that one thing to add to that is, and I'm saying this even with Jennifer in the room, often grantors are asking for a lot of information and for you to do a lot, and you're not going to get that much money. Don't say you can do more than you can, and it is very, very tempting to do that because you want to get the grant, you know, because you're trying to do the work. But it's something that's really important to sort of just keep in mind as you measure success and as you think about what you're going to be telling people you're doing. Though they are asking for a lot, they know they're asking for a lot, and they know what is, you know, humanly possible. So don't promise more than that. So one of the big questions is, what funding areas do diaper banks fall into? And they really can fall into numerous areas. And we've had success in all of the areas listed below. Health, you know, and when we're talking about health, what we're talking about is, and we're going to go into this in a little bit more detail in a minute, is children's health. And there are articles and things that we'll share with you that indicate healthy diaper changing makes a real difference. This is a women's issue. While it is true that there are lots of single dads in the world and lots of dads who are involved, and there are lots of two-parent households, the majority, and I'm not looking at the numbers right now, but single women with children are the poorest group of people in the country. It is a women's issue because children are connected to women by and large. It's a children's issue. You know, I think that's the issue. That's the area that's the easiest for people to think about. Poverty, you know, to me personally, that's the biggest issue. This is, diaper banks provide to a large degree a window into the reality of living in poverty for families. And the area on, you know, the area of economic success and stability, you know, we believe, and we believe this strongly, and we're trying to get data to prove it, that people can be more economically successful and more stable if they have diapers for their children. So it depends on the area, the specifics of your diaper bank, for which program you're going to apply for and what you're going to focus on. But it also has to do with what the grantor wants to support. And that is hugely important, because even if you can prove that this is going to impact families who live in poverty in your area, if they're only supporting health, they're not going to fund your grant.
One of the things about writing grants for diaper banks is that sort of raising awareness about all the things that diapers affect. And so we're going to go through the next couple of charts of how these diapers fit into a couple of different areas that are most often attached to grants and grant making. First off, health and economic welfare. Diapers impact the physical, emotional, and economic health and well-being of families in a number of ways. On a direct basis for the infant or child himself, the physical consequences of insufficient diapers are directly correlated to issues of hygiene. Prolonged exposure to dirty diapers can result in diaper rash, skin diseases such as dermatitis, as well as an increase in urinary tract infections. Also, the increased likelihood that waste captured in a diaper could escape increases the possibility of contamination of the family house. Because a baby wearing a dirty diaper is uncomfortable, he's more likely to cry, to be irritable, and to be unable to sleep, which can only cause an impact to the child's health, but also to the family's health, because there's increased tension in the household, leading to decreased mother-child attachment, and could result in a greater likelihood of neglect and abuse of the child. And for more on these effects, we recommend you see the Huggies Every Little Bottom study, which we'll share with you all after this, which is available on our website, and we'll share after this webinar.
So the area of children's issues and economic security are really very, very interconnected. First and foremost, the inability to enroll a child in child care due to a lack of diapers makes it so a parent can't go to work. You know, there are some programs, primarily Early Head Start and Head Start. Some of them do provide diapers, and that's great if your community has that, but many communities don't. So that a parent can't bring the child, you know, if you don't have somewhere safe for your child to be, you can't go to work. And I think that is something that most people don't think about. And this is one of those sort of aha things that goes along with diaper banks. Why does a diaper matter? Because going to work matters. Why does going to work matter? Because if you can't go to work, you can't pay your bills. So this idea that, you know, sometimes you hear people talk about parents not wanting to work. Sometimes there are real concrete barriers in the way, and that's what we're talking about when it comes to diapers. The other sort of issue is that children, even very, very young children, come to expect certain things in their daily activities. So if they go to childcare every day and all of a sudden they can't go, it really does impact the child's well-being and how they're feeling. And we have a quote here, and we have this article that we will share with everybody, but it does indicate, and this is a peer-reviewed report, that instability in child care arrangements, it's linked to a range of negative outcomes. And these are real things. They're not things that everybody thinks about, but what we're doing in writing grants for diaper banks, aside from trying to get money to run our diaper banks, is to help people understand why this is a significant issue.
As Joanne mentioned, diapers are a children's issue, and because they're used by children, they wind up being a women's issue because women do the majority of child rearing in the United States still. Additionally, poverty strikes both children and women disproportionately hard. More than one child in 5 American children lives at or below the poverty level, and while the majority of families headed by a female single parent live at or below the poverty level, more than 54%. These numbers increase tremendously when we take into account low-income children as well, that families that are living at twice the poverty level. 48% of children below the age of 5 live in low-income families. 69% of all families headed by a single woman are classified as low-income and below. Diapers are a basic need, not only because that are now out of reach for many poor and low-income families, but can also affect the abilities of families to get out of poverty because, as Joanne mentioned earlier, you can't leave your child, if you don't have diapers, you can't leave your child at child care, and parents can't go to work as a result. They're also required at those child care centers most likely to provide those child care centers most likely to provide the high quality child care that will prepare children for later educational opportunities. So it affects poverty, children, educational opportunities. These are all things you can sort of weave in together by using the latest census figures.
So, why diapers matter to everybody? The cost to society are all of these things that are listed here. They don't impact every person, but they impact a number. So the costs associated with child abuse, there's lots of research, actually more about neglect than abuse, that supports the fact that many, many reports to the Department of Children and Families, or whatever that department is called in your state, have to do with poverty, have to do with not having the things that families need. Then you have the larger issues of the societal cost to lost wages and lost educational opportunities. It's not just that parents can't go to work if they can't bring their child to child care. If they're in school, they can't go to school. Many high school students and college students and even mothers and fathers who are a little bit older are need to go back to school in order to be able to progress. Then there's also the issue of medical costs. We do not have a lot of research in that area, and that is someplace that we are trying to get more information having to do with the medical costs for treating increased cases of diaper rash. But we know that it does exist. And the questions that come up about why diapers, why should we be funding diapers? Because diapers make a difference. small things impact big things, and a small thing like a diaper can make the difference between a mom or a dad being able to go to work one day. And when you're working an hourly job that doesn't have benefits, the difference between going to work one day and not going to work one day can be a huge difference. It can be the difference between having food in your house. It can be the difference between paying your rent or your utilities. So while we are in no way saying that you should suggest that granting you money to provide diapers in your community is going to end homelessness in your community, there is a correlation between making sure people have their basic needs met and being able to do more and have more for society.
There are a number of different articles, and one of the things we recommend these two in particular as having very strong correlation between the effects of diapers on children and children's health and economic conditions, and also social well-being. We're going to put these up on our website. We'll share these with you, but we'll have these along with other articles we come across under tools for diaper banks, because to the extent you possibly can, rooting your grant hypothesis in peer-reviewed academic articles really does sort of help lend your credibility to your hypothesis. It's not just something that you think, well, this seems sort of like it makes sense. These articles suggest that there's a real correlation between diapers, health, and economic opportunity. So we'll put these up. We also recommend taking a look at using the Every Little Bottom study, which surveyed women across the United States and Canada, and a few other things we'll put up on the website.
So this is when we are going to open up to questions. Jennifer is still here, Jennifer Heath from the United Way, and I think that Allison is busy unmuting everybody, so it may take a minute. Oh, here, now we're here. So if people have questions that they'd like to ask, we're happy to try to answer them.
Hi, Joanne and Allison. Can you hear me?
Yep, we sure can.
Hi, it's Pam Sutherland from Happy Bottoms. And I have a general question about output and outcomes. Because I think that perhaps we, meaning us, have somehow kind of confused the two in a way. I mean, we do measure outputs in terms of, obviously, the number of diapers distributed, the number of children that we distribute, the number of families. We also identify the number of unique children because there's some children that we service each month. We gather data from all over. We service 16 agencies, and we gather data, demographic information, on all of our children that we service, from race to poverty level to zip code, et cetera, et cetera. So we do have a pretty robust system. But I wanted to go back to something you were saying about the outcomes, that just, the number of diapers alone is really not something that a grantor is looking at as a measure of success. How would you recommend going about gathering? I know you gave examples of what to gather, but, in our case, additional information, because we service organizations that cover, their daycare centers and foster care and outreach and emergency services. So we have all sorts of different agencies that we service, how to pick just one outcome at the different types of levels of service that they provide.
Right, that's a great question, Pam. And the truth is, you can't pick one outcome for all of those agencies, and that's what makes it hard. You're going to need to look at your child care agencies differently than you would your healthcare facilities. And this is what actually allows you access to a variety of different grants. So if there is someone in your community who's interested in early childhood education, you can write a grant. They'll see your whole budget and everybody you support, but your grant would be for supporting for giving diapers to those child care agencies. And whatever outcomes you chose, like attendance, you know, whether it's parental attendance at meetings, if it's daily attendance, whatever it is that you wanted to look at, you would ask the agencies that are supported by that grant. It can become complicated because, you know, the truth is that not everybody can give you all that information. And there are different ways to do it with your agencies. One option is to have sort of all your questions out there and only, you know, have them answer the ones that they need to. I think that's probably a less realistic option because it's harder on your agencies to sort of have to look through and figure out what they're supposed to tell you. But an example I have is at the Diaper Bank here in Connecticut. Very early on, we got an empowerment zone grant, which we were only able to use for agencies in certain zip codes. And it required us to do a satisfaction survey of those agencies on a monthly basis. So we just sent that to them on a monthly basis, and we were able to report on it, and we didn't collect it from the others. Because one thing that is complicated, and I don't know if Jennifer wants to say anything more about this, but when you are granted money for a certain part of your program, you have to be sure that you're reporting on just that part of the program. Mm-hmm. Did I go too far on that, Pam? Was that more than you wanted to know? Okay.
I have a question.
Okay.
I'm working with agencies now. Most of them, and I remember back in the last webinar, you said to break diapers up into sleeves of 10 or 12, and that was for tracking purposes. But wouldn't that also be the same way with these grant tracking? Is you do it per diaper, right?
Well, there are two things.
I think. And stuff.
Right. I think that we suggested that sometimes that can work to break up into sleeves. You know, certainly people do it in lots of different ways. But you're doing, you know, you are doing it by diaper, but the questions can't all be by diaper. The questions have to be about people.
Well, I know that, but you said for the grants it needs to be sort of uniform on tracking. Most of the agencies in my town, in the area, will do per diaper. There's one that will do it only based on packs. It's split up boxes.
Right. I think that's, you know, I think that's maybe something we should talk about a little bit offline, but I think that, you know, part of what we need to, what you need to do in dealing with your agencies, just like we have to do in starting the National Diaper Bank Network, is that, you know, there's certain information you need, and if the agencies can't give it to you, you can't, you know, you're getting money that somebody is entrusting to you to do a certain thing, and you have to be able to give the answers to your grantor that they are looking for.
So, basically, if the grantor wants it per diaper or whatever, I have to give it to the grantor. And that was basically what the question was. I've got the other issues pretty much worked out on that other thing. So.
You know, this is Jennifer from the United Way. I'm trying to think. I can't think of, in really any instance, where a funder would say you had to do it by diaper. I mean, usually funders are interested in understanding how you, as the applicant, are going to track outcomes and form your budget. And you might have some back and forth around that. But I mean, we've never dictated to someone that they had to report around a particular unit.
I mean, I'm assuming if it's like a parenting program, how much was the increase in that parenting program? How much was attendance? Is that about right?
Yes. Yeah.
Mm-hmm.
Anybody else out there with questions?
Joanne, it's Pam Sutherland again, and somehow towards the end of you were talking, and somehow my sound just stopped, and I'm not sure what happened. and Jennifer, you're probably going to cringe when I ask this question. It's kind of a follow-up what you're talking about. So obviously we need to do more to develop outcomes, you know, pick something. Right now we are writing grants. This is going to sound terrible, but how do I promise we're going to, and I know you said don't promise more than you can, but do I say we're going to start measuring an outcome that we haven't, or, you know, if they say, what are your outcomes now, or I don't want to say we're making things up, that's what I'm asking, but I can give them certain pieces of information that are really outputs. If I don't have the kind of outcomes you've described, what should I say?
This is Jennifer. I would definitely highlight the outputs that you have because I think that is good evidence that you've been tracking your work and you have a system for collecting information. And then I would say to them, you know, where it's appropriate in their list of questions, say these are the outcomes that we're working toward, and this is how we plan to measure them. And I'd be upfront. I mean, I'm all for kind of being as transparent as possible and saying, you know, up until this point, we have not been collecting this particular information, but because we have this strong relationship with our partners and have a way of tracking, you know, the information about outputs, we're confident that we can collect the information we need around outcomes, and this is how we plan to do it.
Okay, and that's, I mean, that really sounds good because we have spent the last year developing the infrastructure to gather this information, and we do. I mean, we receive it via a Google Docs that we've set up, and we have all of this on every client that we do.
That's great. You're way ahead of the game. Absolutely, believe me, you're way ahead of the game.
So, so it's, you know, it's fine to say, hey, we've developed this so we can gather it, and then, you know, we're working towards the next part, developing the outcome.
Absolutely. Okay. I see that as just the natural next step in your evolution and your maturity as an organization.
Thank you so much.
Anybody else with questions? I know there are a bunch of people out there. We're very, very glad that so many people joined us. Sorry, go ahead.
Hi, Joanne. It's Harley from Junior League of Boca Raton Diaper Bank. How are you?
Hey, Harley. How you doing?
Good. I am asking if anybody who's on the call would be willing to share some of the data collection that they utilize, because I think that's where we're really struggling, is trying to figure out what in the world we collect. You know, we have like 20 different things going on, and we're trying to figure out how to streamline it. If they could possibly share it on the Diaper Bank Leaders group.
I'm sure that people would. I think that probably, since not everybody is on this call, why don't you send an email asking people to do that, if that's okay, Harley?
Totally fine. I totally get that. I'm just trying to get that desperately because we're trying to make sure that we have this right focus going into our new year.
Sure. Also, if you want to send it on to Allison or I, we can take a look at it and see, you know, what you're looking at.
And I know in the email that you had sent out, that I think Allison had sent out to everybody about, you know, what you guys are eventually looking for from us, there was something that was supposed to be a template on the web page, but I've not been able to locate it yet for the tools for Diaper Bank.
Let me send. Yeah, Harley, I'll go ahead and send you that down. We haven't had some problems posting things, so we'll get that to you.
No problem. Thank you.
Oh, no problem. The other thing is, I think Jennifer said this, and I think it's really true, that it's really important not to overpromise, but it's also really important to say what you're doing. So if you are collecting something, even if maybe it turns out not to be just the right thing, you know, the fact that you recognize that outcomes matter is not something that everybody recognizes. You know, that's something to focus on as well. Any other questions out there?
Yeah, am I on mute?
You are not on mute.
I am not. Hello, great. This is Corinne at the DC Diaper Bank. One of the things we've been grappling with is trying to really show our impact in some visual ways. And I'm wondering if you guys have ideas, or if any people have, other folks have done things around mapping or around anything like that that has kind of a geographic imprint or shows kind of visually where we are, not as a way of getting around the outcomes issue, because I think the outcomes issue is important, but it's one we're struggling with, and I think we might better be able to show what we're doing as we're on that path to getting to solid outcomes. If we can show... Go ahead, I'm sorry?
Specific for grants? Like, do you have grants that you think you would want to show that on?
You know, yes, grants, but also just generally talking about our work. I think like some of the other questions I've heard here, and I think some of the things that we're struggling with and that I know other diaper banks are struggling with is this question of outcomes. And while we might not have all of the data and information that we wish we had, we do have some. And some of that I think, like we collect zip code data. So some of that's very visual data. And I think not in lieu of, but until we get to the full outcome data, have people had success showing what they're doing in terms of mapping?
I've not heard of that happening. Jennifer?
You know, I've not seen it around diaper distribution, but I'm just thinking about some other projects I'm familiar with where they're focused on particular neighborhoods or sections of a region. And one of the things I've seen that's pretty interesting is they do show, and this is fairly sophisticated, so I don't know exactly what's involved in doing this kind of mapping. But one of the things that was interesting was the organization was able to show, like by color coding or different color dots or things like that, neighborhoods that were particularly low income and had large numbers of young children, and that information you can get from the census. And then they did an overlay of, so then where were their services, and tried to show that their services were particularly targeted to, you know, like the dark purple or the dark green, if that's what represented neighborhoods that had large numbers of young children or large numbers of families with young children living in poverty.
Okay.
So I do think that can be an interesting visual to show that, one, you're aware of what the need is in the area that you serve and that you're really targeting your services to those areas of greatest need. That said, as someone who reviews grant applications, like our system isn't even set up to accept such a beautiful document. Like, you know, we require all of our applicants to come in through an online system, and you would have no place to put that other than describing it in a narrative. So I think it would be useful information potentially for you to have, but you might not get to show it in that pretty format to most funders because they're going to make you come in through their system that limits you to X number of characters online with no attachments.
Yeah.
So.
Thank you.
You're welcome.
We've got about a couple minutes left, so if there are any last questions, we're happy to answer them. And if there are people who prefer not to, shout out in such a public forum, we're happy to take emails there. Look at my fancy little thing. Any last questions before we finish up?
So I
nope.
Send you
all
an
right.
email
Well,
that issue.
I'm sorry?
So I can send you an email about that counting issue?
Sure, you can send us an email. That'd be great. So we will be posting the webinar on the website, and we also will be sending the PowerPoint to everybody who registered for the webinar, though it won't have the audio. We really appreciate you all joining us.
Is there any way to get the PowerPoint from that first webinar we did?
We can send that to you, Sam.
Yeah. Jane will send that out. We'll be sending out this, and we can include that one for you as well.
All right. I appreciate it.
No problem. All right. Thanks so much, everybody.
Thank you.
Thank you so much.
Okay. Have a great day.
Thank you.